Hi, my name is Renata Tanaka. I guess I'm here to tell a story about my surgery with at this hospital. It all started with a pain in my stomach, probably at the beginning of November, and it increased into severe bloating and discomfort. I went to my regular doctor to see what it possibly could be, and for about a week or two they were treating for some kind of gastrointestinal issues without actually doing an ultrasound or doing anything like that. They had just kind of poked around on my stomach a little bit and decided that it was gastrointestinal. After 2 weeks of various treatments, various medications, it wasn't getting any better. It was actually getting much worse. And I was becoming increasingly more bloated, and I was actually kind of looking pregnant at that point. So it was quite painful, and it was not comfortable. So I finally went back to them, and they told me that I needed to speak with a gynecologist who had looked and had me do an ultrasound, and he said, listen, you need to speak with a gyno-oncologist. And we had looked through my insurance, you know, the hospitals that were covered with my insurance, and this hospital came up. And the doctor, the gynecologist that I was speaking with at Mediclinic, said, you know what, there's a very good gyno-oncologist over there, Dr. Khaled. And they had asked me to, you know, he called Dr. Khaled right away, and Dr. Khaled said, no, I need to see her tomorrow. And so I saw him the next day, and he had done an ultrasound as well, and I got a very good vibe from him. He was very, very kind and very knowledgeable. And he, you know, right away he said, okay, this is something we need to look at, because he found a couple of ovarian masses. And he said, this is something we need to look at. And so he sent me for an MRI. He actually called around to different MRI clinics to try and get me into an MRI right away, because he thought this isn't something we should wait on. So he got me into an MRI, and I went to the clinic, but because I was so bloated and distended, I couldn't actually fit into the machine. So I went back to see him the next day, and we had done some blood tests and things like that, and he said, okay, we need to take some liquid from your abdomen, and we need to test that. And so he tested it, and he said that, you know, it's something that's probably not good, and so we should, you know, we need to schedule a surgery. We need to put in the paperwork for the insurance. We need to schedule a surgery and all of that. And I was like, okay, no problem. And in the meantime, what we had done though, because I was so uncomfortable and it was started to affect my breathing with all the liquid that was filling into my abdomen, he said I should come here to the emergency and have it drained. And so I did that, and I was admitted, you know, right away. I don't even think I waited a minute or two in the emergency. I kind of walked in, I spoke to the receptionist, and they said, okay, go to this room. And then so many doctors came to visit. That was the first time I met Dr. Sadir and Dina, and they had come in as a team and kind of explained that, you know, they were going to also be working on the case. I also met Dr. Sobi, who was also great. And so I just met so many different doctors, which was amazing, because everybody seemed so, you know, so willing to help, really, which was amazing to me, because where I come from, I'm Canadian, and we have public health insurance, and you don't walk into an emergency room and have somebody see you immediately. You kind of sit down on a chair or lie on the floor, depending on how bad you feel, and you wait a long time. And so I was really, really impressed with how quickly everything was taken care of. You know, they admitted me into the hospital because I guess the ascites was kind of restricting my breathing. They put me in the ICU right away so they can monitor my breathing and all of that. And then the next day I had the procedure to drain the liquid. And over the course of the next 3 days, they drained 9 liters of liquid out of me. which was a huge relief because I started to feel better immediately. You know, even after the first 3 liters, I started feeling good. And they moved me from the ICU after a couple of days back to just the general ward, which is absolutely beautiful. I kept accidentally referring to it as a hotel because that's what it looks like to me, like a very nice hotel, not a hospital room. It's like a hotel with a hospital bed in it. It's very nice. So I was there for 3 days, and then I went back home to await the surgery. And basically what we were doing was we were waiting for the insurance company to come back and approve. So after a couple of days stay in the ICU department at Zahra Hospital Dubai, they moved me into the general ward on the 6th floor, and it was wonderful. It was, I kept on accidentally referring to it as a hotel because the room actually looks like a hotel room with a hospital bed in it. So it's absolutely beautiful and very comfortable. And I do like also the fact that there's a couch in there for visitors, and you know, people can come and stay as long as they want. It was really, really comfortable and really nice for family and friends to come and visit as well. Due to the ascites building up in my abdomen, when the second time I saw Dr. Khaled, he had recommended that I actually come to the emergency room at Zahra Hospital in Dubai to have the pressure removed. And so the first procedure was really just to remove the liquid from my abdomen so that I was feeling a lot more comfortable, because at this point it had already started affecting my breathing. And so I came to the emergency hospital at Zahra Hospital Dubai, and they admitted me like immediately. It was, you know, I walked in, I spoke to the receptionist, and they put me in a room right away. I met with several doctors, including Dr. Sadir and Dr. Sobi, and Dina, the coordinator, had come in with them as a team to show me that this is the team that was going to be taking care of me within the hospital. And they admitted me into the ICU department at that point so that they could monitor my breathing while we were going to go through this procedure. The second day, we went and they put a tube in and they drained the liquid from my abdomen. Over the course of 3 days, they drained pretty much 3 liters a day to take out 9 liters. Just starting from the first day, as soon as they took out the first 3 liters, I felt so much better. And they had moved me into the general ward at that point. And the general ward is beautiful. Actually, it's like a hotel with a, you know, with a hospital bed in it. It's big, it's spacious, and it has a lot of amenities, and it has privacy, which is wonderful. Where I'm from, you don't really have, you know, you don't really have a walk-in to an emergency clinic or emergency hospital and get served right away. You usually have to wait quite a bit. You sit down and you wait for potentially hours until it's your turn to be served. So this was something extraordinary as far as I could tell. Compared to my past hospital experiences in Canada, this was much faster, much more efficient, and the doctors, just being able to see all the doctors right away was really comforting, because again, in Canada you don't really get the doctors' attention that much. So it was a wonderful experience. After the 3 days that I was here for the draining, I then went home to await my second surgery. And basically what we were waiting for was the insurance approval. And that takes a few days here, because this was going to be a big procedure. This was going to be removal of my ovaries, my uterus, fallopian tubes, and then other stuff in there. Lymph nodes, lots of things. So the insurance was going to take a while. And then in addition to the removal of all of those things, the doctors thought that a HIPEC procedure, which is a kind of, my understanding, based on the description that the doctors had given me, was it's kind of like a heated internal chemotherapy treatment that would kind of kill everything that was microscopic that they couldn't see and take out. This was going to kill it. And I'm an internet researcher, so when I did the research on it as well, everything said that this is, you know, for a woman my age, relatively young, a woman my age with this type of cancer, this increased survival rate dramatically. So I was thrilled to hear that Zahra Hospital Dubai is one of the only places in Dubai, if not the only place in Dubai, who actually offers this service or this procedure to their patients, because everything that you do read on the internet says this really does help prolong your life or increase the survival rate. So, you know, Dr. Sadir has a lot of experience with this particular procedure, and you know, I felt very confident that they were using everything that they could to help increase my chances. So I really, really appreciated that. And of course, you know, when I was doing my internet research, to have a gynecologic oncologist in there as well also increases your chances. And, you know, having Dr. Khaled there for that was, I think, also really, really, really important for my case as well. So we were having problems with the insurance, and at the same time the ascites was increasing in my abdomen again. And so it got to a point where it was starting to get uncomfortable again, and I came in here to see Dr. Sadir, and he, you know, I was back and forth with the insurance trying to get them to accept this procedure, and I was getting a lot of runaround. And then Dr. Sadir said, call them in my office here. And so I did, and he took the phone and he spoke with the doctor at the insurance company who was supposed to be reviewing my case, and he explained everything to him and explained the importance of this procedure for me, and within half an hour I had the approval. So, you know, it was really, really good to have Dr. Sadir in my corner on this one, because he got it done. And, you know, and then they said, okay, let's clear the schedule, and you're coming in on Saturday and we're going to do this. And again, where I'm from, a procedure like this probably would have taken months to schedule. It wouldn't be like, okay, on Saturday we're clearing the books and we're doing this for you. So, I mean, the doctors just seemed like they cared so much about me and the suffering that I was going through with this ascites and this. I had 11 liters on the second trip in my abdominal cavity, so it was very uncomfortable. And so the doctors just were so supportive, and they were so caring that it took me by shock, actually, because it wasn't something I was used to from my previous experiences in my home country. So the doctors here at Zahra Hospital Dubai are phenomenal, and the caring that they show to their patients is phenomenal. After the surgery, the surgery was great because I came in one day before. I spoke with a cardiologist who cleared me. I spoke with an anesthesiologist who came and explained absolutely everything that was going to happen. You know, from the time that I got into the surgery room, I guess, everything that they were going to do, when I would wake up, these are the tubes that would be sticking out of me. They explained everything so that when I woke up, there was no shock. There was no, you know, oh, what's this weird thing in my back? I knew exactly what was happening. So when I woke up, it was great, because I had known what was going to happen. All the doctors were there surrounding me when I woke up, and you know, it was a really good experience, that part as well. I did go to the ICU for a few days after that. I was very, very tired, and I slept most of it. I don't remember much, but they did come every single day the doctors all came in. So Dr. Sadir was there every day, Dr. Sobi was there every day, Dr. Khaled was there every day. Everybody came by every day just to make sure that everything was going well and that my recovery was going along quite well. They had a physiotherapist come in to make sure that I was exercising, and so we went through a bunch of different exercises to make sure everything was moving. You know, they got me standing up within the first 3 days. They had me walking on the 4th day. Then they switched me back to the general ward. And of course, you know, I love the general wards. It's wonderful in there. And then, you know, from that day forward, I was just walking up and down the hallway. Again, all the doctors were coming to see me. In the meantime, they did get the pathology report because they had done I guess once they extracted everything, once they took everything out, they had to do all the, you know, pathology testing on everything, and they did come back, and they came back with an excellent pathology report. The cancer is only stage 1C, which is you know, fantastic. It was caught very, very early on, which is quite rare. But I think it was because these doctors were just, you know, as soon as they saw the symptoms, Dr. Khaled was like, you know, we need to act right now. So, of course, the survival rate increases dramatically when it's caught very early like that. So, overall, it was, you know, very good news. And when each of the doctors, because I spoke to each of the doctors about it, and I could see in their face how happy they were for me and how relieved they were that this was, you know, such a low stage. And it really made me feel like they care. And again, I don't know if that's rare in a doctor, but all of the doctors here exhibit that at the Zahra Hospital in Dubai. So the overall experience has been great. The recovery was very quick. So what am I now? Maybe 2 weeks after I guess today is 2 weeks from the surgery. I've been home for 5 days, 6 days. I'm pretty much back to regular life. I'm a little tired, but apart from that, I'm mobile. I can do everything that I was doing before. I'm not pushing anything. I've been driving for a few days now. I don't know if that's recommended, but it's fine. I'm fine. So yeah, overall it was just very, very efficient, I felt very cared for by everybody, and it's actually been, all things considered, a wonderful experience. When you're talking about surgeries of this magnitude, to actually consider it a wonderful experience, I think is pretty good, because I'm sure it could be a lot more traumatizing than that. And I have no complaints, only praise about everything that everybody's done here for me.
Hi, I'm Dr. Khaled Kouteich, consultant oncologist, gynecologist in Zahra Hospital Dubai. I'm part of the team of Cancer Center here in Dubai, and I'll be talking about one new technique brought here in the country and in the Middle East in general also. It's the HIPEC, and this HIPEC is the heated intraperitoneal chemotherapy for gynecological cancer and especially for ovarian cancer. And I'll be talking about one case that we did recently, and it was a successful surgery for ovarian cancer. And we, as we all know, we are here to give the best treatment for our patients, and with the new and the best techniques even that are available worldwide. We are trying to bring the best techniques and the latest to our practice here to serve our patients. We are here actually to help the patient and to give them all the information about the curative treatment for cancer, because the treatment for cancer is like a war between the therapy and the cancer itself. And in the gynecology tumors, and especially in the ovarian tumors, the surgery is #1, followed by chemotherapy, and usually it's the intravenous chemotherapy. The cytoreductive surgery is the goal and the gold standard in the treatment of ovarian cancer, but sometimes when the tumor has spread inside the intraperitoneal cavity after the surgery with some cells that they are very small and we cannot see them by the naked eye inside the peritoneal cavity, we need a special treatment for this kind of cells, because the recurrence rate of the ovarian cancer is very high intraperitoneally inside the abdominal cavity. So this kind of treatment, which is the HIPEC, the heated intraperitoneal chemotherapy that we bring inside the abdominal cavity and the peritoneal cavity, a high dose of chemotherapy heated above 40 degrees, and that it lasts for at least 90 or 120 minutes. It's like a machine bringing the chemotherapy from outside within in a tube inside the peritoneal cavity, and it will go inside to try to kill the whole cells, tumor cells inside the peritoneal cavity, and then we will remove it out by other tubes. This surgery with the cytoreductive surgery usually takes between 6 to 8 hours, and usually it's a very important and very heavy surgery for such kind of tumors. So in this case we have to counsel the patient, and we give the information, all the information available before the surgery, and we give all the explanations available, and we need to share with the patient all the information. So this kind of surgery is one of the major surgeries in cancer, and especially in gynecology. During the surgery we might have many complications due to the surgery itself, due to the tumor itself, and due to the spread of the tumor itself. And after the surgery also we might have some complications due to the surgery itself, like infection, like bleeding, and due to the chemotherapy, because this kind of treatment needs a special follow-up. Because after the surgery we might have some complications related to the surgery itself, like infection, like bleeding, and some other complications due to the technique HIPEC itself, like for example low motility, low intestinal motility, or dehydration, or renal insufficiency, anything like this. So this is a special technique that we brought here, and we put in our cancer center in Zahra Dubai. As I said in the beginning, it's one of the latest technique, and it's the only available technique for some cases of gynecologic oncology tumors, and we are proud of having this technique here in our center, and we are looking forward to serve many patients with this technique, and we are having more and more experience with this technique. I would like to thank the patient herself for accepting to go through this surgery.
Accordingly to what Dr. Khaled Kouteich said, our director of the GYN oncology in Zahra Cancer Center, at this point we try to figure the importance of the HIPEC therapy in ovarian cancer, and also the other type of peritoneal carcinomatosis. This is a new train that we brought from United States to Middle East. I start the first 3 cases at Rawi Hospital, which is a government hospital in Abu Dhabi. Now we are the first center in the private sector in UAE or in the Gulf, other than Saudi Arabia, that we have started this type of technique. The HIPEC technique, according also what Dr. Khaled Kouteich said, it is 2 hours hyperthermia plus chemotherapy after doing the major debulking, and hopefully that will be removed 100% of all the cancer. We try to clean the cells that has been left behind or not been seen, or small amount of disease, to run into the peritoneal cavity with the closed abdomen with the chemotherapy with a temperature about 43 degrees centigrade, and that will kill all the cancer cells and also go to the depth of the tissue, because the temperature increases the permeation of the chemotherapy to these parts of the peritoneal cavity. The cases of the advanced carcinomatosis are getting more and more and more, because people who are considered are non-candidate or non-resectable. Now we are really clearly with our team of Zahra Cancer Center, including Dr. Ali Dami, including Dr. Khaled Kouteich, and with the rest of the anesthesia team and the ICU team, we are working as one group to make this opportunity and this type of technique available for all Middle East. I just got another case yesterday from Pakistan. The patient flown from the airport, come to the ICU admission, and we managed to get the HIPEC therapy for her in 24 hours. That is the center of the excellence for all the subspecialty of cancer treatment, and a center of excellence for doing advanced carcinomatosis and cancer cases that we are treating in our Zahra Cancer Center. With the help of the administration, with the help of the marketing team, with the help of all colleagues in our center in Al-Zahra, we managed to put the first step and the stone for this big cancer institute. This cancer institute is going to serve all the locals and non-locals and all the people from Middle East to get that type of treatment available, rather than they travel to United States or travel far to like China or other places. We are here available 24 hours 7. We have our navigator available with the phone numbers, and also we are having the free second opinion available to any cancer case that we can treat it. Please do not hesitate to call the number 971 055 1010169. This is the navigator number, and we are more than happy to take care of any second opinion free, as I said. Thank you.